communicate the amount of radiation or the risk from radiation exposure, we use specific units. In this video, I will describe the radiation units in the SI and classical systems and discuss their appropriate application for diagnostic imaging. From a perspective of diagnostic radiology, the three pertinent units are air kerma, absorbed dose, and effective dose, and we will discuss each of these individually. Now let's consider the simplest of radiation measurements, which is the amount of radiation measured in air. This unit is called as air kerma, which is an acronym for kinetic energy released in matter. Air kerma is a measure of radiation intensity in air and reflects the energy absorbed per unit mass. The SI unit for air kerma is gray, and the conventional unit is Röntgen. Now let's consider some practical applications of the air kerma unit. We use X-rays to image patients in our clinics. During the imaging procedure, we may stand behind a protective barrier to minimize the amount of radiation to our cells. In this situation, we would want to know how much radiation is emitted from the X-ray tube and how much radiation is transmitted through that protective barrier. Likewise, we would also be interested in knowing how much of the radiation is transmitted through the wall into the waiting room, where it can expose other patients or members of the public. Regulations require appropriate room shielding when ionizing radiation is used, and this would require the measurement of air kerma at various locations to design appropriate shielding. As part of equipment maintenance, the output of an X-ray tube is measured on a periodic basis to ensure that the machine meets standards as per state regulations. So to summarize, air kerma is measurement of radiation in air and is most often used by our medical physicists when they characterize the X-ray tube output and the transmission of this radiation through walls and barriers. During imaging, we expose various tissues to differing amounts of radiation. The unit absorbed dose measures energy that is absorbed by individual organ or tissue sites. Since this unit measures energy that is absorbed per unit mass, it is also expressed as grays. The conventional unit for absorbed dose is rad. So some practical applications of absorbed dose. It allows us to indicate how much radiation has been absorbed at specific sites with specific radiological examinations. Dent-maxillofacial radiological imaging uses low doses of X-rays, and thus the absorbed doses are typically in micrograys or milligrays. A knowledge of the absorbed doses from specific radiological examinations allows us to make decisions on the safety of those examinations. In this situation, a pregnant patient requires dent-maxillofacial imaging. Knowledge of the absorbed doses to critical sites allows us to make the determination that dent-maxillofacial imaging during pregnancy does not cause any potential effects on the fetus. Radiation is also used to treat tumors. During treatment planning, the absorbed dose to the tumor is designed to maximize tumor killing. Additionally, the absorbed dose to certain normal tissues is also measured so that we can minimize damage to normal tissues. From a practical point, both clinicians and patients are interested in knowing what is the risk from radiation exposure. Effective dose is an estimate of this risk. It estimates the stochastic risk from radiation, which includes cancer and heritable effects. From a point of view of dentomaxillofacial imaging, heritable effects are negligible. Thus, radiation-induced cancer is the only risk from dentomaxillofacial imaging. Effective dose considers that certain tissues are more sensitive to cancer or heritable effect induction than others. Considering this differential susceptibility, tissue weighting factors have been derived for individual tissues. When the risk of cancer or heritable effects is higher, the tissue weighting factor is higher. Thus, effective dose normalizes the absorbed dose to an estimated effect. The SI unit is sieverts and the conventional unit is rem. There are several limitations to effective dose. It is an estimate, it does not consider gender or age at exposure, and it does not account for individual differences in susceptibility to radiation. Nevertheless, effective dose has practical applications for diagnostic imaging. For example, effective dose allows comparison of the risk from different radiological examinations. Since effective dose is normalized, a 5 microsievert exposure to the head and a 5 microsievert exposure to the hand have the same anticipated cancer risks from radiation. As dentists, we are occupationally exposed to radiation. Regulations limit our occupational radiation exposure to 50 millisieverts per year. This limit is an effective dose. There is one more unit called the equivalent dose, which considers that different types of radiation deposit different amounts of energy and thus cause different amounts of damage. To normalize for the differences between the radiations, this unit applies a radiation weighting factor. However, for diagnostic X-ray photons, this weighting factor is 1, and thus it does not have any practical implications for diagnostic imaging. So, to summarize, the most important units in diagnostic radiology are air kerma, absorbed dose, and effective dose. Each of these units has a different purpose of measurement, and make sure that you are familiar with the units used to convey each of these measures.